Welcome everybody. It's such a privilege actually to have been invited to this. I got asked to come and do this by someone who trained me in scar therapy, who is the most amazing scar therapist. So I'll share her information, her Restore directory later. But it's an absolute privilege to be in the room with you today. I can already sense and feel the magic that is going to happen. There's a lot of mind-body connection things going on today, which I love. As you listen to everything that I have to share with you, whether you have a scar in the room or not, I invite you just to tune in, because you may well know someone or someone in the future who does have surgery or has a scar, and this information that I'm going to share with you today can be absolutely life-changing and transformational. So, hopefully, as you listen to this presentation today, I'll be able to illuminate a new perspective on scars, a different way of thinking and seeing them, and perhaps even a different and new avenue of hope and healing. So, welcome to my world of cancer wellness. In my world, we never talk about illness. My entire ethos is wellness. So this is where you can find me, well, this is me. So I have two kind of businesses. One of them is PhysioCare Holistics, which I'll share in a minute, and I'm actually evolving into Simone Grove Cancer Wellness, because there is so much more than physio and holistics that I share. So if we click the next slide. So what do? I provide a fusion of clinical and integrative cancer care. I help people navigating cancer, whether they are living with it, beyond it, or wanting to reduce their risk. Move forwards from a place of fear and overwhelm to clarity, vitality, and empowered wellness. Through specialist clinical care, holistic care, and integrative treatments, metabolic health, mindset, emotional well-being, and education, I also train health professionals as well. I show people how much power they have to transform their well-being and reframe their relationship with cancer. So a little bit about me. So I'm a specialist physiotherapist working in oncology and palliative care. I have 30 years of background working in cancer care. I'm a scar therapist. I'm trained with Restore Scar Therapy, who I'll share some information with you later today. I'm trained with Scar Work, Sharon Wheeler's therapy, and I also trained many years ago with an absolute expert in the field who's no longer with us, called Willie Frory from South Africa. I'm a clinical reflexologist, I'm a clinical aromatherapist, I'm a lymphatic drainage practitioner, I am a master practitioner and trainer of NLP, so that's neuro-linguistic programming, so that's bringing the mind-body connection into the mix, and I do hypnosis as well. I'm a CAM rehab specialist, cancer exercise instructor, and a metabolic regen terrain advocate. For anyone who knows of Dr. Naisha Winters, I'm trained with Dr. Naisha. I work very closely alongside her. She's an integrative oncologist in the US. So that's me. If you can do the next slide, please. Thank you. I think the other thing to note is I work a mix privately for myself in those two companies, and also I work at the Christie Hospital and the Christie Private Care. So I know Professor Jason's coming to talk this afternoon from the Christie as well. So I keep my hands in with clinical and private work as well. So we're going to talk a little bit, well, the theme that's going to run through this talk today, actually, which you'll see coming through, is the mind-body connection. Because the mind and body are connected, and we don't have wellness without both mind and body wellness. It's really important. So very often I see clients focusing either all on the mind or all on the body, and I very much was a body worker, but now what I have learned over 30 years is I see the transformation that takes place when patients and clients focus on the mind part of the mind-body connection as well as the body part. So every bit of information that we have, every neurological thing that's coming into our body that we're processing is in both the mind and the body. The same information is in every cell, no matter body or mind or body. So it's really important that we actually focus more holistically and focus on the bigger picture. And the mind-body together is what brings wellness. Okay, thank you. So why scar therapy? So some of you are going to have scars in the room, some of you are not. But why would I see someone for scar therapy? So imagine if you had a scar, whether from a cancer surgery or another surgery or another type of injury. Imagine if there was a way to improve the look and feel of your scar. Imagine if there is a way to improve flexibility and release tightness in a nurturing, nourishing way to your body. Imagine if there was a treatment that could help improve sensitivity around your scar, where we've got numbness or changes in feeling, no matter how long ago the scars were formed. Imagine if pain associated with tight scar tissue could be eased. And imagine if future aches and pains related to tight scar tissue could be prevented. Would that be useful? I hope so. Yeah? Okay, so the next slide, please. So for those of you in the room with scars, it's time to wear your scars with pride, feeling confident in your skin and remembering that those scars are a sign of your inner power. Okay? Next slide, please. So, a scar may look beautifully healed on the outside, but this is key. It's what's going on beneath the surface of that scar that matters. So how that scar was formed, how that scar is healed, how that scar continues to remodel itself, and whether there are adhesions tethering the layers of the skin to the layers of the deeper layers of the skin and the fascia, and then into the muscle below and the layers below. So next slide, please. So the impact of tight scar tissue across the body. Now, I did think about coming in one of these suits, and when I teach health professionals, sometimes I will get them to put one of these on. I decided against it today. But I wanted to put a visual, because I want you to imagine that you have got your clothes on and you've just stepped into kind of like a painter's and decorator's all in one suit. You've zipped it up and you've got your layers of your underwear, your clothes, this outer white suit on top of you. Now imagine if I took loads of safety pins and I started safety pinning through, like these badges, through the layers of the white suit, but then I caught through to your t-shirt underneath, and then perhaps your bra underneath, and if you see on that side, you know, like a mastectomy scar here. Imagine if I'd safety pinned all the way along and caught all the layers underneath. And then imagine if I had an abdominal scar, perhaps maybe one running down the centre of your tummy, or like a C-section scar along the bottom. And I'm safety pinning, and I'm pinning all those layers from that white outer suit to each and every layer below. Do you think you'd be able to move very much? No, everything would be tethered and tight. And our body, our skin and our fascia, there's no beginning or end. We're enveloped in this skin and fascia in our body, and so the minute we have a scar in one area, that automatically affects every other part of our body. So there's so much more to scars than meets the eye. So the next slide, please. So I've put some pictures. I've just taken these from the internet because I actually don't really ever take pictures of my patients or clients. It's just not something I do. But I've put a few, we'll swipe through a few different images of different types of scars. Some of you may have heard of like hypertrophic scars, keloid scars. There's different things that I would look for. I'm not going to go in depth into that today, but just some examples of what different scars that I see may look like. So if we can just swipe through. So you can see we've got more keloid, more like hypertrophic scars with different redness. We've got scars where we can see the staples and where stitches and staples have been. And sometimes the area of a stitch actually can be something that can be quite limiting for someone, and it can be the tiniest little thing, but you'll often find one tiny little point of a scar where a problem's coming from. Again, we've got kind of lower down scars, so some like C-section type surgery, ovarian cancer surgery, you might find that you've got like a big scar down the middle, or smaller like bikini line scars. We've got a little lumpectomy scar on that side. And then if you can just swipe through. So what is scar therapy? So this is a bit more technical. I'll read it out, but I don't expect you to remember all this bit. So Scar therapy is a real mix of kind of scar work and scar massage. So scar work is a very specialised, gentle, very, very gentle, manual treatment to help anyone with any scar tissue, whether it's from surgery, it can be from other things as well. So any scar tissue, fibrosis, adhesions, and change in tissue health following a surgery, an injury, radiotherapy, a burn or an accident. It encompasses all of that. Scar massage is very commonly used to help remodel and promote improvement in scar tissue. And it's a really gentle therapy. So sometimes we might use special oils or massage balms to hydrate and smooth the scar, and it's very rhythmical, it's very relaxing. It's possibly the most gentle treatment you can imagine. And most people say, like, I don't feel you've done anything, and then they'll come back the next week. It's so different. Treatment helps to promote the circulatory and the lymphatic systems, which is hugely important in any cancer care, and around the area to boost healing. And then I've said already, natural oils or balms can help deliver nutrients to promote skin regeneration healing. Next slide. So scar treatment focuses on areas of tightness and tension around the scar, as well as the underlying fascia, the muscles of any fibrotic tissue, so it's much deeper than the surface layer. Scar treatment also looks at the mobility of other areas in the body. Again, it's not just focused on the area where the scar is. Remember that picture of the all-in-one decorator suit? Everything is linked. You have a bikini line scar here that's really tight, that's going to affect your shoulder, it's going to affect your back, it'll affect your neck, it can affect anywhere. So I regularly see clients who refer to me with like mastectomy, breast cancer scars, that have come in with like a painful neck or a painful shoulder, and they actually come to me from the physio that works next door to me, and they've gone to her because they're struggling with doing something. They might be struggling playing golf or doing something they want to do, and actually it's the tightness in the scar that's led to those aches and pains to begin with, and one-off scar treatment can change all of that. So releasing tightness in the scar has such a knock-on effect for the whole of the rest of your body. Okay, so next slide please. So I thought I'd share my personal story in a snapshot. I've not got a cancer story, but I had jaw surgery in 1992, many years ago, probably like over 30 years ago, because I was at university, my first year. When I was 11, I had some teeth out and it wrecked my jaw, and I had a lot of pain. I lived with chronic pain. The version of me who you're seeing right now is not the same person that I was back then. I lived with chronic pain. So I had some jaw surgery like in 1992, and it was completely miraculous and I was absolutely fine. I then went on to have a series of other random things go on. So many years later, I had a lumpectomy, and I got a little tiny lumpectomy scar. I had some laparoscopic surgery for endometriosis, so again, tiny keyhole little scars. And then 10 years ago, I had an emergency C-section, and it was that C-section scar that literally changed everything for me. Literally, within years, probably 2 or 3 years, my jaw was terrible again, and the disc in my jaw had popped out, because suddenly I'd got more safety pins through those layers, coming back to that white suit, and that final scar was the scar that literally changed it, and then I was tight, so tight down my right side, that suddenly that had an effect on my jaw, okay? And scar therapy in my C-section scar has completely changed that. So that's kind of a little insight. So the next slide, please, thank you. So benefits, like why would anyone want to have scar therapy? So lots of reasons. So it releases tightness, and if you've got a scar in the room today, you may or may not be aware of tightness in your scar, but I suspect some of you are. So scar therapy can help loosen and release tight scar tissue to reduce discomfort. And the key thing here is it's never too late to work on a scar. Whether it's a newly healing scar or a scar that's 20 years old, scar therapy will always make a difference. It can help with restricted mobility, so by reducing tightness and encouraging mobility between the layers of skin, fascia and muscle. It can stimulate and boost healing, so catching people early after surgery from probably 6 weeks onwards, within those first couple of years, it can really help with boosting the healing and encouraging the scar tissue to lay down in a really beautiful way for future healing. And it's often recommended by surgeons to promote optimum scar healing after surgery, just like lymphatic drainage is. And from a medical person working with scars, I would work with scars from 6 weeks post-op. There are many complementary therapists trained in scar therapy as well, and they would wait till 8 weeks post-op, and they would check with medical healthcare professionals that that's okay to start working on that scar at that point. It can reduce sensitivity and pain, so very often we get altered sensation and like areas of numbness or different sensations around the scars, and whilst that is never like a big deal in the bigger picture of surgery, sometimes it's really helpful to try and improve that sensation for people, and from a mind-body perspective it can make you feel a lot better. So therapeutic touch and working around scars can actually, not always, I won't say forever always, but you can reduce the pain, you can reduce this and improve the sensation and reduce that numbness around those scars. And most of all, it supports emotional well-being. So this is really where the mind-body connection comes into play, and I know we've got a talk just after this which is going to go into a little bit more about the emotions, but the emotional well-being is the biggest game changer that I see when I work with scars as well, because we hold quite a lot of trauma and just unprocessed negative emotions sometimes within those scars. Okay, so the next one. So this is a game changer, I think. I share this with all my patients. So holding on to or avoiding processing negative emotions or trauma doesn't serve anybody ever, especially not on a cancer wellness path. So working gently over scars is so much more than the physical. It provides an opportunity and a safe space to really gently feel into those emotions that were associated with those scars and treatment and surgery. It gives an opportunity to allow those emotions to rise and allow your body to gently process and release them. And it can be the most powerful thing. So never underestimate the power of the mind-body connection on a wellness healing journey. The next one, please. So how can scar therapy make a difference? So I mentioned I never really take pictures of my clients, so I'm not one to come up and take pictures of kind of scars that people have had an experience. This one was slightly different, and I've got permission to share this. So this scar on the hand, I don't know if you can see it very well, but it was a gentleman who was actually referred to me from a solicitor's. They was going through a court case, had an injury with a drill at work, and I saw him for 6 sessions. So this was how, and he's let me share these slides, so it's on a different part of the body to what we're probably talking about today, but you can start to see. So this is how he presented to me, and I'm not sure if you can see it very clearly. And then after a couple of sessions, on the left-hand side, that is the difference already in the scar. So the bumpiness, it was really red, it was really raised, it was very, very red, and he was very embarrassed. He used to wear things and cover his hand all the time. So that's how it kind of changed very quickly after 1 or 2 sessions. And then on the final slide, this one again is how he presented, and that was after 6 sessions of working on his hands. So very, very, very different. So scars will phase, they will lighten, the redness will go, the texture, the bumpiness, the lumpiness will like flatten down is probably the best word. So yeah, thank you. So what scars can be treated? So all scars, like absolutely everything. So all surgical scars, C-section scars, cancer surgery scars, including those, there might be people in the room that have had experience cording or axillary web syndrome. You'll often hear about people after breast surgery getting cording, so it helps with that as well. Capsular contracture after breast surgery, and work around stomas and graft surgeries as well, and after radiotherapy. Joint replacement scars, radiation fibrosis, cosmetic surgery, and anything that's been like a traumatic injury or a burn, that kind of thing. So literally anything. So when's the best time to start scar therapy? So ideally, if it's a new scar, I would start working as early as possible. So within the first 16 weeks, but usually from around 6 weeks post-op. It's really when the cellular activity in the scar is really high, because when we're working with the scar at that point, we can really encourage the scar and the cells and the tissues to remodel in a different way. So never wait for a scar to be problematic either to seek help. So we always suggest that people book an appointment in the first few months of surgery or after an injury. But self-care can start as soon as the scabs of that scar have fallen off, so probably 10 to 14 days post-op. Now for self-care, you may be taught in the hospital, it's not something that I see being taught very much in the medical world, if I'm honest, but you might be told to get some oil or cream and gently massage your scar, but very often people are not taught how to. So it's really important, the pressure's important, the duration's important, the product you use on your skin is really important. So for anyone that wears contact lenses, the pressure is almost like as though you were touching or putting a contact lens in your eye. So it is so gentle, which is why people often think that you're not really doing anything. And self-massage, I would start with maybe 2 minutes, work up to 5 minutes, never more than that, because then you can irritate the scar a couple of times a day. But all scars are different, so timeline for healing are always different and unique to the individual as well. But it's never too late. Scar therapy can help you even years down the line after a scar. And then people, you might have heard about scar products, so I talk about this a lot with my clients. So we use things like silicone gels, with SPF in them if it's the summertime, compression garments, oils, creams. There's all sorts of things. Now, when you're going to use products like this, it's important to use them early. They don't have as much impact on older scars. So for anyone that you know is going to have new scars, telling people to look up and find out about silicone gels and things like that is really, really beneficial. Have your next slide, please. So a little bit about self-care for anyone that has a scar. So as I said, silicone gels and creams during early healing are amazing. They can minimise symptoms such as itching as well, actually. Silicone sheets and strips can be really good, so you might see those. They're like a bit of cling film, but a thicker plastic, and they're in sheets, and you cut it. So if it was like a C-section scar, you'd cut it in that shape, and then you would sit that silicone on and just wear it for the day. It would stick on. And they can be really good for those hypertrophic and keloid scars, those scars that are quite raised, red, bumpy. Oils like rosehip oil is amazing. I'm going to mention bio oil, so please don't panic if you've used bio oil here in the room, because everybody usually has. But there are so many better oils with much less kind of chemicals and different nasty things in them than bio oils. So I would suggest using rosehip oil. It's a really well evidenced oil for scars. So if we're coming back to that kind of evidence-based approach, rosehip is amazing. There's other balms and things that I use a lot of. I'm an aromatherapist, so I make lots of oils and things for patients as well. What else? Scar products will make the biggest difference in that first 6 months. So it may be people in the room, it might not be relevant, but it's really good to know, because you might meet people in your clinics or friends or other people that you can then share this information with. For a mature scar over 2 years, those products are not likely to help, but scar therapy, scar massage will help. Being really conscious about sun protection as well. Scar tissue is really delicate, it's fragile, so any scar exposed to the sun should have a high SPF, especially in the first 2 years. So we'll often use silicones with an SPF in them. And sometimes compression garments may be used for keloid and hypertrophic scars as well. So the next slide. So what if you explored scar therapy, and what if scar therapy helped you to feel more comfortable in your skin and gain body confidence or regain body confidence? What if you had the opportunity to nourish and nurture your scars with the love they deserve, and had a twofold effect by also nourishing and nurturing your mind-body connection to wellness? What if the safe, supported space and therapeutic touch of scar therapy could support your emotional well-being as well as your physical well-being? What if you tapped into your mind-body connection for wellness? What if you gifted your scars with the self-compassion and self-love that they deserve. After all, they're a sign of your inner strength, aren't they? Next slide. So, for those of you who are local or want to get in touch, you can find me on those things, so PhysioCare Holistics or simonegrove.com. And then I think on the next slide, I want to share this about Emma. So you may want to follow Emma Holly. She's the most amazing, inspirational person. It's been an honour to train with Emma. I've trained with her a few times. I link with her very much. So she's on a mission to train as many health professionals and as many people as possible in scar therapy to get this out widely across the UK. She's actually teaching in Singapore at the moment. It's Emma who asked me to, or passed me over the details to come here today. So Emma has created an amazing Oncology to Restore Scar Specialist directory. So for those of you who have come from wider afield, you can Google that and find a scar therapist near you, or share that information with other people that you feel it may benefit from. Is that the last slide? Oh yeah, that's the last slide. So, just to sum up, everyone deserves to feel confident in their body after surgery, don't they? It's time to reframe those scars.
But thank you so much for being here.